pregnant in San Francisco sometimes feels like you're an alien from outer space who's doing something super crazy. There aren't a lot of my friends who have babies or who are even thinking about it. It can sometimes feel like you're from another time and space entirely. We toured a bunch of different hospitals around the city, and for me it was a definite gut instinct that I knew I wanted to choose the Women's Center.
We switched over to the Women's Center because we had heard from many people this hospital very much listened to you and respected your wants and needs.
The Women's Center is a community clinic in the Mission District of San Francisco. It's a women's health clinic that's been around for decades. We are made up of midwives and doctors who take care of women across the lifespan.
We are truly a collaborative practice, which is also quite unique. Our patients have the option of receiving care with midwives or the doctors, or both.
All of our team members, from the MAs that you meet when you walk in the door, all the way through the labor and delivery nurses, and certainly our obstetricians, really believe in this model of care. We've all made it our mission to take care of women in a way that's respectful of the patient and what they hope and what they want for their pregnancy.
Really try to tailor the care for each patient, spend the time to figure out what their preferences are, how we can meet those needs, and just take it one patient at a time.
You're not just a body. You're not going to be rushed out of the hospital.
It feels like you have a community of care, a place where people are going to take care of you, really get to know you.
We sat together and worked on our birthing plan so that we had agency in deciding how we wanted to give birth.
Patients have the option of group prenatal care, where about 8 to 10 couples are grouped together and do prenatal care as a group.
I wanted to meet other people who were doing the same crazy thing that I was. So that was why I was really drawn to the prenatal group program.
The Women's Health Center offers alternative complementary modalities to help cope with the pain, namely Ayurveda, a herb-based lifestyle change dietary form of medicine, and also acupuncture for pain during labor in people who are averse to taking an epidural.
Pediatric needs really start before the baby's even born. We are collaborating with the midwives and the OBs to find out what it is about this family that they might need from us once their baby is born. The pediatricians can be present at the delivery if needed, and they're there in the hospital with 24/7 coverage in order to support the needs of the baby until the time that they're sent home.
We're really proud to be able to take care of everyone, to maintain that sort of community roots that we have here, which is really important to our mission.
The staff is brilliant and loves what they do.
It has been a very amazing and special experience for me. If we give birth again, I will definitely give birth again at the Women's Center.
My mom was actually the first one that got to hold her, and then they put her on my chest, and it was amazing. I can't even talk about it without tearing up. My experience was just, I'll remember these nurses for the rest of my life.